This is part two of a two-part series on therapeutic boundaries. It is intended as part of staff training at Summit Preparatory School. In part one, we talked about the difference between boundary crossings and boundary violations. A boundary crossing is done intentionally to reinforce the therapeutic relationship, and it's always done in the best interests of students or families. Where a boundary violation many times is done to meet the needs of a staff member and also involves a level of familiarity which can actually be therapeutically harmful to that student. Let's look at some examples, beginning with self-disclosure. When is it okay? It's when it's a boundary crossing, or it's a very purposeful self-disclosure for the benefit of the student, typically to reinforce that relationship. I can empathize with you, or we have things in common. This is something we like to do, or in certain circumstances, I know what it's like to be a struggling teen. In that second circumstance, that would be something you'd want to talk with your treatment team first. When is it not okay? When it's not really purposely planned as a boundary crossing. The danger is that too much self-disclosure can change the nature of the relationship from a therapeutic one to more of a friendship, which can cause great difficulty when you need to place limits on a student, because it can be very confusing if you act like the friend at one moment and then the next have to place a limit on them. Where a therapeutic relationship that balances both relationships and structure allows you to be close to that student while still placing limits. So the primary question to answer is, does the self-disclosure serve the student's therapeutic goal? And there are some warning signs that perhaps the self-disclosure is not appropriate. For example, if you're sharing about your own personal needs or problems. Now, there are some rare occasions when this might be okay, but before you do this, you need to go to your treatment team and your supervisor and talk to them about this. For example, if you're working with a depressed student, there might be occasions, if you have it cleared beforehand, where sharing that you too have wrestled with mood issues at some point in your life might help the student understand that you really do empathize with them. But again, you need to be very, very careful, because this can sometimes turn into the student comforting the staff member when that's really not appropriate. The next can be disclosing war stories. That's right, kids, when I was your age, we didn't have any fancy filters. We had to swim around all day in our own. Again, you get the idea. This is where self-disclosure turns into, as it were, bragging about your own past experiences, often to appear cool. This can sometimes happen with the staff member bragging about past drug and alcohol use, for instance. So you need to be very, very careful about that. If disclosure is common rather than a rare event, again, if you're sharing about yourself other than sort of common everyday, yes, I like this book, or I like this movie, or I like to hike, but sort of deeper level self-disclosure should be a rare event and should be deliberate. When it's overdramatic, again, that in many ways, if you're begging the student for a comfort, if it also places you in the role of a guru, just do like I do. We're there to be important role models for these students, but ultimately they're the ones who have to decide who they're going to be. If it's self-indulgent, it's meant to really make you look good. This can occur with name dropping, for instance. If it's clearly not connected to something that the student is working on, if it doesn't really seem to serve a therapeutic purpose. And again, if it appears to confuse the relationship, where the student begins to wonder, are we friends now? And the problem with that is that, again, it can make it very difficult for you to act in more of a parental role, providing limits and consequences, because the student can be very, very confused if you act like just another peer or friend one moment and then have to place limits the next. Again, by balancing both relationships and structure from a therapeutic standpoint, you can have a close relationship with a student and still be able to provide appropriate limits. And a sort of a good way of judging whether or not what you're going to say is appropriate, are you comfortable sharing your decision to self-disclose with the treatment team or with that student's parents? If you're not sure you are, then you better not do it. And you better check with your treatment team at least first. Next, what about physical touch? When is it okay? And it is okay at times because our students do need a certain level of physical comfort. But it needs to be chaste touch, touch that cannot be misinterpreted as sexual. And you need to be aware that some students will interpret touch differently than others. So you must be very, very careful about this. It needs to be of short duration, to provide comfort or support, or to recognize a student's accomplishments. It's why we do side hugs, but it could be a pat on the back, a handshake, a high five, or a more public hug like at a stage advancement. So that is appropriate touch. But when it's not okay, any touch that could be misinterpreted or that is sexual in nature is obviously not appropriate. It's a huge, huge red flag. Any touch that really does play favorites and it's only given to select students, such as I only give high fives to my favorites, this is also not okay. Any touch that's not non-sexual, but it's really overly intimate in nature, similar to more what close friends would do, like giving a shoulder massage or something like that. And excessive touch. Touch is important for our students, but it needs to be done very carefully and very deliberately and not be excessive. So a good question to ask before you touch a student in any way, like pat them on the back or whatever, is does this touch serve the student's therapeutic goal in a way that can't be misinterpreted? Because you have to be very, very careful about touch. We have some students who have been sexually abused who have a hard time reading the intentions behind physical touch, which is why you need to be very careful with how you sit or stand next to a student. And different students can even interpret physical proximity in different ways, even how close you are to them. So again, you need to be very, very cautious about physical touch. And why this is so important is that people interpret events, including physical touch, based on their past experience, not based on your intent. There are a number of things to pay attention to help prevent anyone interpreting your behavior as sexual misconduct. So respect the cultural differences, and as we've already mentioned, be aware of sensitivities of individual students, recognizing that some students will interpret touch or the things you say differently from others. Do not use gestures, tone of voice, expressions, or any behaviors which could be seen as seductive or demeaning or at all sexually abusive. Do not make sexualized comments about a student's body or clothing, so you do need to be careful about the compliments that you give. Do not make sexualized or sexual demeaning comments to a student, and this includes any suggestive remarks or suggestive jokes. It's not appropriate for a staff to share that with a student. Respect and do not criticize a student's sexual preference. Do not ask details of sexual history or sexual likes and dislikes. It's not appropriate unless it's a therapist who's truly working on that as an issue with a student and who also is sharing that as part of clinical supervision with their clinical supervisor or medical personnel for medical reasons. Do not engage in any inappropriate physical behavior with a student. Do not engage in any contact that is sexual or could be even interpreted as sexual in nature. Do not talk about your own sexual preferences, fantasies, problems, or activities. And be very careful regarding potential miscommunications. So even like if you're complimenting a student, be careful in what you say about that so that they don't somehow misinterpret that as you being somehow interested in them sexually. What about accepting gifts? Is it ever okay? First of all, if you ever accept a gift, it is something you need to disclose to your supervisor. And it's only okay when it's a small gift in a situation where not accepting it could create hard feelings, could create, let's say, a gulf between you and a parent. Next, there has to be minimal potential for creating a sense of obligation. This is the primary reason why accepting gifts can really cause problems within the therapeutic relationship. It sets up an obligation where I gave you an expensive gift, so now you need to give me something in return. You need to allow my students special privileges, or you need to promote them now. It interferes with the ability to make therapeutic decisions. Possible alternative to receiving a gift could be saying, you could make a charitable donation to the organization, to maybe its scholarship fund so another student can attend, or you can give a gift to the entire student or staff community. When it's not okay and considered a boundary violation is again where it creates that sense of obligation, which again confuses the relationship, creates an obligation to reciprocate even when it's not in the therapeutic best interest of a student. If the gift is overly personal, it also implies a friendship or another non-professional relationship, which can also make it difficult to sometimes do what needs to be done from a therapeutic standpoint. Finally, if the gift is expensive and is really treated as extra payment or a tip, as it were, it can also create a non-therapeutic situation within that relationship. So the primary question should be, does accepting this gift serve the student's therapeutic goal better than not accepting this gift? And if you don't clearly know the answer to that, you should not accept it, at least without checking with your supervisor first. And you always need to share with your supervisor any acceptance or any consideration of the acceptance of a gift. What about social relationships? It is not okay to form a social relationship or a friendship or to go out socially with a student or family member being served by Summit Preparatory School. However, sometimes pre-existing social relationships exist. If you find that this exists, that needs to be disclosed to your supervisor immediately so that ground rules can be established. This would include that student not being on your treatment team. But also need to take really sorting through the issues of confidentiality, because there are things that you may not be able to share with that family that you might be tempted to because of a friendship or a social relationship. In addition, because of your social relationship, there might be things about that student that really should not be shared with you by that student's treatment team. Obviously, the exception is any safety issues that you need to be aware of to help keep that student safe. You also need to be careful that there's no obligation being created where there's an inability to act in the therapeutic interest of that student based on that obligation sort of outweighing what's in the therapeutic interest. They need to be careful that there's no possibility of exploitation, and there's also not the expectation of special treatment. There also should be no business or financial gain derived by either party because of the dual relationship, meaning that you should not be entering into business dealings with active clients of Summit Preparatory School. What about if you meet someone accidentally at a social function? Well, first, there is an obligation as an employee of Summit Preparatory School to maintain a certain professional decorum regarding how you behave. So you need to be careful when you're in a setting that includes a client or a family member of Summit Preparatory School. Also, if you meet them academically beyond a sort of a cordial, warm greeting, it's really up to them to initiate a longer conversation. There might be times, though, when you actually plan some kind of a social event with a student or a family member, and as long as this goes to the treatment team first and meets with treatment team approval, this is okay. And this can include things like perhaps meeting with a family for lunch following graduation or something like that, where it really is in the therapeutic best interest of that student. When is it not okay? It is not okay to form a friendship or a business relationship with a current student or family member. There should be no financial or material gain by either party because of this dual relationship. You need to be careful that there's no sense of obligation created by either party because of the relationship, because again, that can really interfere with being able to act in the therapeutic best interest of a student or a family. There should be no special treatment for certain students or family members because they know a staff member. There should be no keeping of secrets from the student's treatment team of information that the treatment team really needs to know because of this relationship. And again, you need to be very careful that the relationship does not become confused. In this setting, your relationship with that student needs to be that you act in that student's best interests from a therapeutic standpoint. Your relationship needs to be clear that it's a professional relationship and not a friendship. So ask yourself this question: does this support the student's therapeutic goal, or does it detract from it? And why boundaries are so important within relationships, including boundaries around social relationships, are because of an imbalance of power. By their very nature, staff tend to be in a one-up position. It's because students are placed by their family here, and they're really coming to us in times of need, often in emotional distress. They're looking to us for our expertise, and many times they are disclosing personal information that we would not normally know, that would normally not be shared within even a friendship. And there's also an important level of trust. They are trusting us with their child that creates a level of vulnerability. Now, students and parents often don't understand this and don't really understand the need for professional boundaries. So they may at times initiate behavior or make requests that actually could result in a boundary violation. But as a staff member of Summit Preparatory School, it is your responsibility to always act in the best interest of students and parents. So you're the one ultimately responsible for managing boundary issues, and you're the one who will be held accountable should any violations occur. And boundaries continue even after a student leaves Summit Preparatory School. So you need to be careful in regards to your interactions with students after they leave. Now, I think it's great that students want to keep in touch. I think it's great that we keep in touch with them, but still, you need to always be considerate of what is in the best interest of even former students of Summit Preparatory School. And certain problems can arise when you're not careful about these boundaries, because once crossed over, it can be very hard to return to the original relationship. For example, if a student starts seeing you as a friend and then you have to put limits on them, it can be extremely confusing to them. This can also lead to further intrusions and obligations, making it difficult for you to act in the therapeutic best interest of a student. It can certainly cloud your clinical judgment and also may eventually lead to more serious violations. Confidentiality. When is it okay to share internally? Well, it's okay to share information regarding a student or a family member with other Summit Prep staff members, especially when there's like a safety or a behavioral concern. Could be a runaway risk or a medical issue, something like that. Or to follow through with a therapeutic goal, which may include, reinforcing therapeutic empathy. And our staff do this a lot. They actually send out emails saying, can you help so-and-so work on a certain issue? And that's very appropriate. In regards to confidentiality, students and family members both need to be aware that what is disclosed will be shared at least with the treatment team. It's very important as a staff member to not keep secrets and to not agree to keep secrets. For example, if you have a student ask you to keep a secret and promise not to tell anyone else, and they tell you something such as maybe it's suicidal ideation that you then have to act upon, you have now broken their trust. And of course you have to act upon that to keep them safe. So it puts you in a catch-22 and can really negatively impact the therapeutic relationship you have with that student. What about the external sharing of information regarding a student or family member? We need to be very careful with this. And typically we need a release of information that's signed by the parents or guardians or the student if they're 18 or over that really specifies what information can be shared with who and how long that release of information lasts. We can also, though, report information in regards to child abuse and neglect. In fact, this is mandated reporting, and this is something that if you suspect this, you should talk to your supervisor so we can figure out how to make an effective report. And certainly in emergency and physical situations, we can share information with emergency medical personnel and with the local law enforcement to protect the safety of our student. There are certainly times when sharing information is not okay. Internally, this includes when sharing information regarding a student or family isn't done for therapeutic or safety reasons and is really done primarily just to gossip. This is not okay. This information does not need to go beyond that student's treatment team. Also, externally, it's a violation of confidentiality if there's no release of information, it's not a mandated reporting situation, and it's not an emergency or a dangerous situation where we need to involve emergency personnel or law enforcement. So the primary question should be, am I protecting the student's confidentiality and am I keeping them safe? We end with a quick review of several key principles. The first has to do with why we allow boundary crossings. It's because overly rigid boundaries really create an emotional detachment that does not allow a therapeutic relationship to form. Staff need to be real people with our students. On the other hand, overly loose boundaries can result in boundary violations. This can really harm not only the therapeutic relationship, but can also be harmful to the student and to the family. Where proper therapeutic boundaries provide a student with a sense of reassurance, security, and safety within a trusting, caring, professional relationship. So make sure you know the difference between a boundary crossing, which is really done intentionally to be a real person and reinforcing the therapeutic relationship, and a boundary violation. And staff any questionable situations where you're not sure. When in doubt, until you know otherwise, treat any step over a boundary as a boundary violation and not a crossing. It's important to be conservative in these situations. And finally, some final questions to ask yourself to avoid boundary violations. Is this in the student's best interest? Whose needs are being served? Will this have a negative impact on a student or a family? Should I consult with a supervisor or colleague? And the answer is inevitably yes. How would this be viewed by the student's family? Would they perceive this as a violation? Then it should be treated as one. How would I feel telling a colleague about this? Am I treating this student differently? In which case I might not be acting in their best interests from a therapeutic standpoint. Does the student mean something special to me? Again, that can interfere with being able to act in their best interests from a therapeutic standpoint. Am I taking advantage of the student? Does this action benefit me rather than the student? Then it's a boundary violation. Am I comfortable in sharing this behavior with the treatment team and documenting this decision behavior in the student record? Or could it be perceived as a boundary violation? If it could, don't do it. And finally, when in doubt, go to your treatment team and go to your supervisor. Thank you.